I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel. Hi, I'm Dr. Bill Adams, Chief Medical Officer of the Plastic Surgery Channel, and welcome to PSC Hot Bites, our newest program where the channel's experts cut to the chase, providing real answers to the questions that you want to know about plastic surgery procedures, topics, or technology. We want to help dispel the myths and marketing spin that often plagues patients and help you get the real story from our credible team. Joining me today via webcam is Dr. Peter Fodor from Los Angeles, California. Peter, it's always great to have you on with us.
Thank you, Bill. You know how much I respect you as a friend and as a surgeon, and there's no time that I perform a breast augmentation that I don't use something that I learned from you. So it's a real pleasure to be interviewed by you today.
Well, we've all learned much more from you, Peter, I think, than you've learned from any of us. But you certainly are a world's authority on liposuction. That's what I wanted to talk to you about to start out with. Liposuction is always the first or second most popular cosmetic surgery procedure. But why do many patients see us who need revision liposuction, and what's important for our viewers to know about that?
Well, first of all, what's most important for reviewers to know is that something can be done if the result wasn't great. But when it comes to redo liposuction, unfortunately, liposuction is performed often by physicians who are not plastic surgeons, and many of them had either no training or maybe at best a training at a weekend course, and maybe they were trained by somebody of their own background without plastic surgeons being part of the faculty. So consequently, some of the work is not done quite up to the standards that we perform it. In addition to that, the number of new technologies, and patients get confused. The manufacturers are promoting these technologies and different machineries as something that replaces the surgeon's talent, which in effect, it does not. So when these procedures are done with some of these technologies without necessarily the best surgeon doing them, then the results are not as satisfactory as they could be. The good news is that we can help these patients. The great majority of them, we can make significant enough improvements that they are ecstatic with the new result. In my practice, about actually more than 50% of the patients that we see and operate on in connection with some form of liposuction have had surgery before that elsewhere that they're not all that happy with the result. So we are very happy to be able to give them something that makes their image of themselves and their ability to function and their self-confidence much better.
That's great information. I had one follow-up, Peter. You've been one of the pioneers of liposuction, so you've really introduced that technology to a lot of us here in the United States. Are you seeing more revision liposuction consults now than you did, say, 10 or 15 years ago? Is there more people needing to have revision liposuction, or is it the same?
For some reason, we're seeing many, many more, and I don't know whether it partially perhaps because I developed a reputation for being able to help these patients, so other plastic surgeons send patients to us. They may see somebody that they did not operate on, but they think maybe they should send to us to have it worked on. But also the fact that many surgeons or many physicians who were not properly trained are doing the procedure. They think it's easy to perform. They take it in a very frivolous manner. When in actuality, it's just as difficult, if not more difficult, to perform good liposuction. Is the sculpting of a full part of the body through perhaps a tiny incision made in the skin with a tiny cannula, and you have only one chance. If it didn't work, you cannot say like a sculptor can say, oh, well, this was just a study, I'll throw away, take another block of marble and start again.
That's great. Well, let's switch gears for a minute. Many patients are asking about short scar facelifts. You have a lot of talents, Peter, but I know you have a lot of experience with short scar facelifts. What is that, and what patients benefit from it?
Well, under the name short scar facelift, and also known as S-lifts and a bunch of other names, basically the concept is that the incision is only in the front of the ear, doesn't go behind the ear and into the hairline from there. And this is a smaller incision. In a way, it makes it a little more challenging for the surgeon to perform the operation. But the other good thing about, especially the way we do the short scar facelift, is that the pull is entirely in a diagonal, vertical direction, as opposed to pulling the facial tissues from front to back, which creates a wind tunnel kind of appearance. Now, the other thing that's different in the technique that we like to use is that most facelift techniques, mobile tissues are fixed or attached. I'm being a little technical now, but they're attached to other mobile tissues. So therefore, the fixation is not as stable. With what we do is we take the tissues and we attach it to a fixed structure, which is the temporal fascia. Again, I'm being a little technical, but that's the only way I can explain why we think ours last better, have better results, more natural-looking results, and why the recovery is so very, very fast, because the skin undermining is very limited. What I was referring to, this fixation, that refers to the deeper structures. So therefore, the bruising is less and the swelling is less, and patients have a very satisfactory result with a very rapid recovery.
That's fantastic information. So the last thing I wanted to touch base with you on is we've been reading your newspaper, the Los Angeles Times, who recently published a story on finding a reputable plastic surgeon. And in that story, they say there's more to finding a reputable plastic surgeon than simply looking at advertisements or going through the business listings. What thoughts do you have on that subject?
Well, quite a few actually, and it makes a lot of sense. I was delighted to see this article because unfortunately, more times people with less training are very masterful and more masterful at promotion and advertising in the print and in the electronic media than plastic surgeons who spend their time with getting appropriate training and continue improving upon their skills and don't have as much time to devote to marketing and advertising. But and the article makes some very good suggestions as to what kind of criteria a prospective patient can use in selecting a plastic surgeon. They may mention the fact that board certification is important. Indeed, it is, but it's important to be board certified by the plastic surgeon they're selecting, to be board certified by a bona fide board, a board that is recognized by the American Board of Medical Specialties, as opposed to some self-created bogus boards. They also talk about belonging to bona fide plastic surgical societies, such as the American Society for Plastic Surgery or the American Society of Plastic Surgeons, or even the International Society of Plastic Surgeons. Interestingly enough, incidentally, if a surgeon belongs to any one of these three, and if they do primarily aesthetic surgery, they usually belong to all three of them, because you need to fulfill the same general criteria to be admitted into membership of these societies. Furthermore, the article also talks about forming a personal opinion about a given plastic surgeon, which is formed at the time of the consultation with meeting directly with that plastic surgeon. And indeed, that is also very important. The only small bone that I like to pick with the comments from the article is that they recommend that patients should be looking for a free consultation from a plastic surgeon, and that they would put that plastic surgeon among the ones that they could consider for their surgery. And I don't really agree with this, because the consultation itself can be and should be a very tedious process. In my practice, we spend about an hour with each new patient. So if the word gets around that we do consultations at no charge, we really would not have time to do anything else, to do surgery and to take appropriate care of our patients after surgery. Our consultation, for example, which is, I think, typical of most well-trained and very respected plastic surgeons, is about $200, and that fee is deducted from the surgical fee in our practice if a patient proceeds to schedule surgery. So it's obviously it's not a fee that will make a living for a surgeon, but I think he's much better off charging a smaller amount so to screen the patients and see only the patients who are pretty serious about their endeavor into plastic surgery, and then be able to give enough time to those patients to carry out a proper consultation. Consultation is as important as any part of the subsequent surgery in figuring out whether the patient has realistic expectations, whether the motivations are in line with what can be accomplished, whether they know what the potential side effects and complications can be, and of course, for them to know what are the benefits that good surgery can bring to their lives.
Well, I know our viewers will really appreciate that information. And Peter, always a pleasure having you with us, and thank you for taking time out of your day to spend it with us.
Thank you so much, and have a wonderful day. And my best to all you viewers as well.
Thank you. So we hope you enjoyed this segment of PSC Hot Bites, and be sure to get your next bite on our website at theplasticsurgerychannel.com, and we'll see you again soon. I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel.